From our 22 News Broadcast Center, this is 22 News in Focus.
Welcome to 22 News in Focus. I'm Taylor Knight. We now know that anyone can become infected with the coronavirus. Special attention is being paid to the elderly and those with compromised immune systems and chronic health conditions. But the medical community is finding evidence that the illness is impacting African American and Latino communities in large numbers, exposing the racial and economic disparities in health and health care in America. Today on 22 News in Focus, we'll be discussing what's being done in our region to address this lack of access to health care in underserved communities. Joining me now is Dr. Madeline Aviles Hernandez, Division Director for Outpatient and Recovery Services for the Gandara Center. The mental health wave that is predicted to hit during and after this pandemic will also affect some of these vulnerable populations. The Gandara Center, which specializes in bilingual behavioral health care, is preparing to treat patients. How is this crisis impacting the Hispanic and African American communities in our region right now?
Hi, thank you for having me. I can say that for all of us, not necessarily specifically for the Latino or African American communities, but for everybody in general, there's a lot of anxiety, there's a lot of uncertainty. And I think that we are all of us feeling that in every way possible. The fact that we can't go about doing our normal routines, that we can't go about doing what it's normal to us, what it's part of our day-to-day. It's very confusing. It's very anxiety provoking. And then just being isolated and not having contact, maybe even with our own family members. It's just very, very hard. We're so used to being social and connecting with people every day, and not having the ability to do that. It's been very, very hard.
Absolutely. So this anxiety, how can it manifest itself in people?
So a lot of our patients are reporting just disruption in their day-to-day, not sleeping okay, changes in eating habits, just feeling nervous, a lot of fear. That's something that we hear a lot and that we're all experiencing to some degree. Fear of going outside, fear of not knowing what's going to happen tomorrow, how long this thing is going to last. So all of those, I guess, emotions and thoughts and feelings combined have had an impact in how people are not just thinking and perceiving what's going on out there, but also their behaviors have been altered, and their emotional and physical stability has been altered.
So besides maybe this fear, what are your frontline workers telling you that they're hearing among clients and their families or their caregivers, now that this pandemic is here?
So there's a lot of difficulty with people accessing food. That's something that we've been hearing a lot. People are scared. They're scared to go outside. They're scared to engage other people in any way, even in when wearing masks and protection. They're worried and very concerned about going to the supermarket, and then when they go, they can't find what they need. Some of them have a lot of transportation issues, and that is a significant barrier for people in our community. The limited bus schedules and the fact that they can't move around as easily as they used to, it's becoming a barrier because then they are having difficulty, like I said, going to do some of their normal things like accessing other services or even buying some of their necessities. So that's been one of the main things that we've been hearing when in conversations with the people that were served.
Yeah, this fear seems like it can sort of spiral out of control almost.
Yes, Yes, we we do our best to try to normalize the situation, but how do you normalize something that it's not normal? How do you help people navigate and address something that it's so foreign to us and so completely different and so completely out of the norm? So just addressing the situation in general, it's difficult. And then when you combine some of those difficulties um, in accessing normal basics necessities, when you add also some of the mental health issues, some of those family dynamics, and everything environmental, it's a very heavy load that most of our people are carrying.
So for people watching right now who might be feeling this fear, this anxiety, what do you want them to know right now?
That there's help, that there's a lot of good, hardworking individuals out there that are available to help them. And it's not just Gandara Center. There are many individuals out there doing a lot of good work for our communities, providing a lot of services. And what I would say is, even though they're at home, even though things are difficult and challenging, to reach out, to call our numbers, to call our clinics, to get on Facebook and look up our recovery support centers, our website, and connect, because we can definitely support them, we can help them. And if we don't have the resources, we will absolutely help them navigate and connect with those that do have them. So just reach out. They're not alone. We may be in our houses, we may be doing things in different ways, but we're certainly not alone, and support and help is available.
All right, thank you so much, Dr. Aviles Hernandez. We will continue our conversation when we return. You're watching 22 News in Focus. Welcome back to 22 News in Focus. Today, we're talking about the impact of the COVID-19 pandemic on Black and Hispanic communities with Dr. Madeline Aviles Hernandez from the Gandara Center. Access to health care continues to be one of the most pressing social issues for Black and Hispanic populations. For those without primary care doctors, they end up in emergency departments for basic medical treatment, and because of cultural stigmas, many don't seek treatment for mental health issues. So, Madeline, how are you and other health organizations reaching out to these underserved communities during this health crisis right now?
So we've been doing a lot of telehealth services. That's been primarily our way of communicating with our community and the individuals that we serve. We have given all of our staff the equipment that they need to be able to reach out and connect with our population. So they've been doing a lot of phone calls. They've been doing a lot of supporting via social media. All of our recovery centers are using platforms like Facebook Live to be able to connect and do support groups, provide information. So a lot of phone and a lot of computers are being used right now to be able to connect, and that's been mostly and primarily the way that we have been able to provide support. We do have our main clinic, it's open. We do have staff, clinical staff, that it's there working every day. We have our doors open from 8 to 5. For those individuals that don't have phones or are not able to connect in any other way, they can still come into our clinics and be seen and receive services. But primarily, it's been everything that we've been doing has been done via telehealth.
So with that telehealth, are you seeing an increase in clients? I mean, there's so many options you were just naming. So are you seeing an increase in people using these services?
Oh, yes, absolutely. I remember when we were started, it was a little bit confusing, even navigating so many different systems and trying to connect with people. Now it's become part of our normal. We call every day, we make phone calls, we connect via the computer, we do meetings, we run groups, therapy groups, we connect with our patients, our prescribers connect with our patients using the computer as well. So by all means, we're getting a lot more comfortable, and the service has been well received by using platforms like this one.
So we know that things like food banks have been seeing an increase in need right now. Have you seen an increase in new clients looking for any help?
I'm sorry, I missed that question.
Are you seeing an increase in new people who are reaching out to you for some help right now?
We are. Of course, not the same volume that we usually see, but we still do have some traffic coming our way. People not just walking into the clinic, but also calling us and requesting services, and we have been able to connect a good amount of people with our clinicians, our case managers, our recovery coaches. So yeah, we've seen a good number of individuals come in requesting services.
Now, how important is it for clients to continue receiving the services that they may have been receiving before all of this craziness started?
Again, this is something that it's very new. This is something that it's difficult to navigate, just because there's still on the one hand, not that much information as to what's going to happen. And then on the other hand, you are being flooded with all sorts of things, and news and reports and different things. So that is very anxiety provoking. We don't know a lot of things, and the things that we do know are scary things. So for people to stay connected, for people to reach out, for people to let others know, yes, I need some support, I need some help. That's very, very important. And we encourage that. And we encourage that because we certainly need all the support that we can get, especially now when we are so isolated and we're doing things so different and so outside of our normal.
Now, is your staff maybe trying to contact some people that they may not have heard from in a while at all?
Yes. So we're actually using all of our staff uses and have access electronically to our electronic medical records. And it doesn't matter how long ago they were seen at the clinics, we're reaching out to everybody. And we don't expect to be on the phone with people for an hour if they don't want to. We don't expect to be on the phone with people half an hour or even 15 minutes. We'll make that phone call and we'll stay with that individual and we'll connect with them for as long as they want that phone call to last, as brief of a conversation they want to have with us. If it's 2 minutes, if it's 5 minutes. For us, what's important is making sure that they have what they need, making sure that they know that there are supports out there and that we are here to support them. And that for us has been the most important thing. So we are reaching out to everybody.
That connection very important in a time like this. All right, after the break, some ideas on ways to cope during this health crisis. You're watching 22 News in Focus. Welcome back. You're watching 22 News in Focus. Today, we're talking about the impact of the COVID-19 pandemic on Black and Hispanic communities with Dr. Madeline Aviles Hernandez from the Gandara Center. So what is the virtual peer recovery center that you offer?
So Gandara has 5 peer recovery support centers. And what that means is these centers are peer-led and peer-run. So individuals that are in recovery are the individuals that are running these centers, and they get to decide what the programming is. ever since the pandemic, we started moving our programming from an in-person, in-center programming to virtual programming. So we've created via our Facebook pages different groups. So our programs and centers have been doing a lot of support groups like morning motivation. They do relapse prevention. They talk about recovery. They talk about supports with families. They do Zumba, smoking cessation. So they do a lot of different things. They just do them through Facebook Live, and they connect with their members and they connect with their individuals that way. And it's not just for the individuals connected to the centers, it's for everybody that wants to join. So there's a lot of us that have been lucky enough to actually benefit from those groups. And that's our way of keeping that level of engagement and support through those groups and that level of programming.
So the Gandara Center offers bilingual services. Tell me just how important this is to offer people.
Well, services in general are important, and people feeling supported in it's a really big thing. And then us having the ability not just to support our community, but actually doing it in their own language, where we can actually relate to their experiences, where they come from, their cultural background, their family background, their religious background. It's very important. And for us, that's our expertise. That's something that we've been doing for over 40 years, and that we do well. And that's something that has made this whole process also of engaging and supporting our people a lot easier. The fact that we have bilingual staff and the fact that we have that capacity of doing things in different languages and accessing people in different way has been incredibly beneficial and important for us.
So the city of Springfield is reporting some clusters of COVID-19 among Hispanic and African American communities right now. Is this reflective of what you're seeing at the Gandara Center right now?
Yes, absolutely. So, I mean, we can't lose sight of the fact that a lot of our people are they work in restaurants. They do a lot of work in essential stores and do a lot of some of them even work jobs that require that level of direct care and service. So we have seen those numbers rise. We keep getting those reports of people and or family members, neighbors that are COVID positive, that continue to test positive. So that is something that it's hitting our community very hard. Not just here in Western Mass, but we've also seen that in the East and Southeast, where we have some clinics as well and programs, that our population, because it's underserved population, minorities, mostly Hispanic or people of color, they are definitely experiencing a lot of disparities and a lot of challenges, and unfortunately, are part of those high number of cases.
Now, could these disparities have a toll on mental health?
Oh, absolutely. Absolutely. Something as simple as they don't have transportation, and then they have to rely on public transportation, for example, and then something that may not things that we may not feel as important as the bus route or schedule changing. That has a huge impact in their day-to-day. They cannot move freely. They can't even go to the store. And when they're there, they have limited resources. They're looking for very, very specific things. And then they go in there and they can't find them. Or then what they can find, it's a lot of things that they need, but with prices that are overinflated. So of course it's hitting our people very, very hard. These are individuals that are already having a lot of needs, and then when you add lack of resources, when you add lack of money or financial resources, when you add high prices and lack of products, then things get very, very, very challenging, and it hits. And that's again when the anxiety comes in, the depression comes in, and the not knowing what's going to happen hits them really hard.
So there's another issue here, of course. It's someone who might be quarantined with someone who is abusive, whether physically or mentally. So what advice do you have for someone who might be in this situation right now or knows someone who's in this situation?
All I would say is the supports are out there. They may look different, but the supports are out there. All of the emergency supports, crisis centers, shelters, those individuals are working. We are all essential employees. We are here to provide services. So it may be difficult, but if those individuals that are struggling in situations of abuse, or that really, really need to access any level of care, if they can, I would always encourage them to call, to reach out to the extent possible, whether it is an 800 number, a hotline, our clinics. It doesn't even matter if it's a service that we don't provide. If they reach out looking for services, looking for resources or supports, we're going to provide them with that information. So just calling and reaching out and letting people know that they need something, because there are a lot of services out there, and we can certainly help them navigate those waters and walk those waters with them, even if it's just remotely, we can.
All right, thank you so much, Dr. Aviles Hernandez. We will have some final words when we return. You're watching 22 News in Focus. You're watching 22 News in Focus. Today we've been discussing the impact of the COVID-19 crisis on minority communities in our region. Thank you to Dr. Madeline Aviles Hernandez from the Candara Center for being here today. And that's it for our program today. Thanks to you at home for watching. If you missed any of it, you can watch it in full on our website, wwlp.com. From all of us here at 22 News, we hope you have a wonderful day.